As you know, ladies and gentlemen, we finished already 6 chapters, and all of these 6 chapters are very important to provide us with the basic information which should we know about the procedure and the leads and the electrodes, and which one is considered positive, which one is considered negative wave, and the leads. So we had a lot of information, and all of this information is like preparation to the next 7, 8, 9, 10, 11, 12, 13 chapter. So before we proceed with our chapter today, which is very important, we have to be familiar about everything I told you about. Why? Because when we say something which is already established, it will be very easy for us to go through the chapter without any interruption, without any like conflict or something make us misunderstanding or difficulty to understand what we are talking. Like when I say PR interval, we are familiar about what is PR interval. When I say QRS complex, we mean what, and what is the isoelectric line, and so and so and so. So all of these informations are like the background or the assets for our knowledge, which is starting from now. From now, I need everyone to keep in his mind and her mind about what? I am going to provide you guys with a keyword. What is the keyword? So each chapter, I will give one word. And according to this one word, you can go through this chapter without any problem. It will be very smooth. So far, you had already everything clear in the previous chapters, so it will not take much effort from you. My question before I start, if you have any question regarding the previous 6 chapters, let me know before I start. All right, this means you are wonderful and you are already understanding everything. What
I actually
about,
have a couple questions.
go ma'am.
Just kind of like the QRS complex and hold on, let me think of the question. Oh, I don't know. Never mind.
Okay, we are going to discuss the QRS complex as a problem when we go with the ventricular rhythm. And you know, QRS represent ventricular contraction. And to be considered normal, it should be less than 0.12 seconds. And it should be like very sharp and high voltage. So all of these criteria of the QRS. If you find anything not like this, so this means the QRS is called wide, not narrow, like less than 3 small boxes. We call it is wide. And so far it is wide. Okay, this is a problem or something wrong with the ventricle. So this is very easy. So what I mentioned is going to answer any question pop up in your mind, Corinne, about the QRS, how it looks like, how it is like wide, how it is like narrow, how it is interpreted if we find something wrong with it. That's it. But if you have any question, of course, you are welcome at any time. So let us go by chapter 7, if we don't have any more questions. Chapter 7 say that sinus rhythm. This is the normal heart. Okay, so what is the key word Al-Haja today is the word sinus means normal. That's it. So throughout this chapter, we find everything as we already learned, which is normal. So if I ask you, CD, what is the normal heart rate? You will mention. If I ask you, Joanna, what is the normal rhythm? You will mention. What is the normal PR? Lewis, you will mention. What is the normal QRS? You will mention. And this will be like going to cover what is the normal P wave. Also, we will cover all of this. And we mentioned this already. So this is why I preferred when I'm going to teach you different chapters, I do link between two chapters, one after another. Why? Because these two chapters like one opposite to the other. So when you make comparison, you will make it easy for you. So let us get familiar about what we are talking. I need everyone to tell me what is the 5 steps you have to go with each step. Number 1.
What is the heart rate?
Very good. Number 2.
What is the heart rhythm?
Very good. Number 3.
The P wave.
Very good. Perfect. Number 4.
PR interval.
Very good. Number 5.
QRS complex.
Excellent. Excellent. So this is, like I told you, this is the 5 steps you are going to cover with any strip on the world. Okay, very good. So far, I told you in the beginning that this chapter has the word sinus. What is sinus? I need to clarify this for you. What is sinus? SA node. Very good. Very good, El-Hajj. SA node. So this means this is the normal pacemaker job sinus coming from SA node. So everything will be normal. So what is the alternative to the word sinus? It is normal. Let us go through what is normal. You mentioned first, Zahra, that the heart rate. So what is the normal?
The normal heart rate is between 60 to 100 beats per minute.
Very good. Excellent. So this is number 1. Let us play together this easy job to make our chapter easy. If I say, guys, that the heart rate is more than 100, what do you think?
Tachycardia.
Okay, very good. And everything else is normal, so I will say sinus tachycardia. You got it? So number 1, I found variation. If this variation is like increased heart rate, like you mentioned, Zahra, I will say tachycardia. But everything else is within normal, I will say sinus tachycardia. That's it. What is the opposite? If the heart rate is less than 60, it will be
Bradycardia.
Bradycardia.
bradycardia. So if everything else is normal, I will say, go.
Sinus bradycardia.
Excellent.
Yeah.
So very easy. You see, guys, now it is very easy that you can diagnose 2 disease. Actually, they are not disease. I think you have like echo coming from you, Alhaj. Yes, okay, thank you. So this means that we have sinus, and if we have variation in the heart rate, we can say sinus tachycardia or sinus bradycardia. You catch it? This is number 1. Very good. What is the normal for the second step? We mentioned the second step is regularity. So what is the normal for our heart? If it is normal, should be regular or irregular?
Regular.
Very good. It should be regular. Perfect. Guys, of course, I respect this wonderful ladies and gentlemen sharing with me by the answer. So our conversation, it should be like with everyone. So please try to participate. So we have the regularity, which should be regular. Very good. What about the P wave? What is the
Upright,
criteria?
smooth, positive, and it precedes the QRS complex.
Very good, very good. Excellent. Thank you, Mark. It is positive, means upright, and it is smooth, and it is preceding every QRS. Very, very good. What if I go by like variation with this P wave? It means the problem coming from which part of the heart? If I don't have normal P wave, I need you to think with me. If I have abnormal behavior of this P wave, this means the abnormality coming from which part of the heart?
The atria.
Very good. Excellent, Lewis. This means this is coming from the atria. Perfect. What is the third or fourth? What is the fourth step we have to cover?
The PR interval.
PR interval. Very good, Zara. PR interval. What is the normal PR interval?
12 to 20.
Between 0.12 to 0.20 seconds. Very good. And this PR interval provide us with what type of information? What is the importance of this PR interval? It guide me to what type of knowledge?
Is the delay at the AB junction?
Oh, very good. It is the conduction time between the SA node to the AV node. Very good. Thank you, Irene. So this is the conduction time, which is between the SA node to the AV node. Perfect. Last step, which is
QRS complex.
very good. Thank you, Stephanie. QRS complex. What is the normal QRS complex?
Less than 12 seconds.
Very good. Less than 0.12 seconds. So if I have any abnormality regarding this QRS, I will think that the problem coming from which part?
The ventricles.
Very good. Correct answer. Very good. So this cover the important issue, which is what we mean by the word sinus, all what we discussed together and you share with me. So this is what means sinus rhythm. If I have variation regarding the heart rate, I will say either sinus tachycardia or sinus bradycardia. And let us go after that to look for if there is a variation in rhythm. We mentioned that the heart should be regular, the regularity of the heart. But if the heart is not regular, this is the situation we are going to discuss together today. Okay, let us go by our slides. And we have wonderful book that it provides us with like summary and revision for each item we get every day. So it will review for you that the site of origin of the sinus rhythm is the SA node. And after that, we have the rate, you know, from the SA node, like you answered, 60 up to 100 beats per minute. And after that, we have very important information regarding the pacemaker, which is the SA node. And after that, we go the transmission, go to the internodal pathway, Then we get the AV node and the bundle of hairs and right and left bundle branch. And eventually we get the Purkinje fiber. And this is the order of conduction. As I told you, when you find these slides do what? Summarize for what we had earlier. Okay. After that, we refresh our knowledge regarding the primary pacemaker fire at what rate, the secondary pacemaker fire at what rate, and the third pacemaker, how it works in such low rate, which is 20 to 40. Okay. As I told you, the key word to remind us for this chapter is the word normal. And sinus means normal. And we have the abbreviation, which is NSR, normal sinus rhythm. You got it? NSR, normal sinus rhythm. Very good. After that, we have to go with the 5 steps like you already done. And we reviewed together the 5 steps. We go to discuss each item if we have a variation. And here, the book do revision for you like we did right now for each rhythm, each item, how it should be like normal. And here we have the golden slide, as I told you. And this golden slide is talking about what is the 5 items should be in a normal sinus rhythm. Very good. If we go to this strip, I think everyone can go by this strip, but I need you to be professional and I need you to depend on your knowledge, not depend on the header. Here, the header telling you that normal sinus rhythm. So you are smart and know what we mean by the word sinus or normal. So you will apply everything here as is. But don't look to the header. Look to the strip only. And this strip only, Stephanie, will guide you, answer 5 questions. And from now, you'll find that we have chapter review and you have to work on this chapter review. I will credit everyone according to this homework. So chapter review is asking you how to go by these 5 steps, one after one. And once you're done, you will get the correct interpretation for the strip, which like this one, which you call normal sinus rhythm. So I would like to give you example, or if any one of you would like to share, and it will make me happy that if you can go by this strip without looking to the header. Who can go by this in professional way? Why you keep quiet?
So would you like us to, like,
70 beats.
while we
Yes,
got,
yes,
so the heart rate is 80 beats per minute.
very good.
Heart rhythm is normal because the R's kind of match out, they map out. So they
Excellent,
lock
excellent.
you
So
in.
we make it like R to R interval is fixed.
Mhm.
Very good, perfect.
And then the P wave, it's less than 0.2. It looks like it's less
No,
than
no, 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 no. Point
no.
P wave, we don't talk about time.
Oh, I'm sorry. I'm thinking about the PR interval.
Okay.
Well, the P waves all look smooth and round. The QRS.
And what?
Oh, and upright.
Very
Sorry.
good, good girl, good girl.
Okay. And then I do the PR interval. That's step 4, I believe. And then
Yeah, correct.
that looks like it's less than 0.2.
Okay,
can't see
so
that
how many small square?
No more than 5. So 0.2 is 5 squares. So it should
Okay.
be between 0.12 and 0.2.
Very good. The last
And
one.
then the QRS should be less than 3 squares. And it
Don't
looks
say
like it's
should. Don't say should. This is like a patient.
it is
This is
it's
like a
less than
patient.
3 squares.
It's okay. So it is a factor, not should. Okay,
Okay.
very good, very good, very good. I really proud of you, Zahra. Very good. So this
Thank
is how to go by this trip, and by the end, you find that you put everything like normal, 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 normal. So you put the header. What is the header? Normal, sinus, rhythm. Good, good. Right? Okay. Let us go by another subject. Like I told you, if the heart rate has a variation not between the range like you mentioned, Zahra, it is like slow, we call sinus bradycardia. That's it. If I ask you, if the patient has sinus bradycardia, should I admit him to the hospital? Should I give him medication? Should I give him whatever? No, not important at all. Okay, so it doesn't need any assessment. So in the exam, they ask you frequently about this issue. This kind of condition need assessment or not? Actually, we have no assessment for such kind of condition. Okay, so let us go by what's the cause of bradycardia, sinus bradycardia. I need you to save the following. Drug, because this is very important in the exam. They ask you about drugs. And remind me, I need one to be alert. Who will be in charge for this? Okay, Zahra, I need you to remind me on next Tuesday, to give you a list of medication. You have to save it for the exam that affect or work on the heart. Today we have the following. Digitalis, you see this one? Digitalis. Digitalis. So I need you to save all of these medications. Digitalis, what is digitalis? If a patient has like heart failure, we give him digitalis. What is digitalis? Increase the power of contraction of the heart to overcome the failure. So this digitalis slow down the heart. Morphine slow down the heart. Beta blocker slow down the heart, and I told you this before regarding the beta blocker. Calcium channel blocker for treatment of hypertension slow down the heart. So this group which I highlighted, this group of medication which I highlighted is wonderful to be answered as such. All of them reduce or decrease or make sinus bradycardia. Okay? And if we go, yes, yes, yes.
Can you repeat that again? Because I'm sorry, it's so loud here.
Okay, no problem. We have here, as I told you, this group of medication, which I highlighted, you see it? Digitalis is for treatment of heart failure. Because in the heart failure, the heart is not working strong to push or to suck the blood. So we give this digitalis, make the contraction of the heart is strong, so it will push and suck strongly, okay? So digitalis is for treatment of heart failure, but at the same time, slow down the heart. What about morphine, which is morphia? Also slow down the heart. This is why sometimes, guys, people overdose of morphia, they can die. Because slow the heart more than accepted will cause this. beta blocker, like I told you, adrenergic, which like if I drink coffee or something like that. So if I give beta blocker, it will block the receptors. So adrenergic or sympathetic nervous system will not affect the heart. So why doctor provide us with beta blocker? For the following: to slow down the heart. Number two, to treat high blood pressure. Okay, slow down the heart and treat of high blood pressure. What about calcium channel blocker? Calcium channel blocker is essential for treatment, God bless you, for treatment of what? Increase blood pressure. So it is lowering also the blood pressure and make the heart slow down. So all of this medication, which I highlighted now, is very important for your knowledge. Produce slow heart. So when we are going to practice together and you find that the heart rate is like 55, less than 60, we have to ask the patient. Maybe the patient is like, as I told you, when we do the electrocardiograph, we ask the medication. You remember, we have like the option in the machine, 3 medication we have to mention. Maybe one of them doing slow heart rate. So when I get the EKG with slow heart rate, I'm not going to be surprised. I have to know that this is due to the presence or the patient is already receiving this type of medication. Is it clear, ma'am? Yes. What's your question,
I
Corin?
have a question. How does vomiting slow down the heart rate?
Very good. Very good. Like we mentioned that we have something to stimulate or make the heart rate getting increased, like I am nervous, I am excited, I am under stress, my heart rate is getting high, right? If I depressed or I'm not having good enough of oxygen, so this make the heart rate to be slow. What about vomiting? What about vomiting? This is very important. Why vomiting slow the heart? Because vomiting is due to what? Vagus. Vagus, you know that we have, if you remember, had you already the nervous system? Okay, so
I haven't
we
yet.
have, okay, I will summarize this for you. We have cranial nerves. We have 12 pairs of cranial nerves coming from the brain. One of them is the vagus nerve. This vagus nerve is number 10. And this vagus nerve is slowing the heart. So it is opposite to the adrenaline. Okay? So adrenaline increase the heart, vagus decrease the heart. So what happened if I am in vomiting? Sorry to give this vomiting. So the vagus is active. So the vagus, which is active, slow also the heart. You got it? Very good. Any question? All right. Any question? As I told you, this golden slide talking about what is the sinus bradycardia. And for make your study easy, you can put these slides with the previous slides and you can compare. And also I need one of you to remind me on Tuesday lab that I am going to print for you memory card, okay, study card that you can compare everything together at your time of study. So if you compare this slide with the normal sinus rhythm, you find that everything is the same, except that the first item is the heart rate is less than 60 beats per minute. Flashcard is very important and helpful. What this? As I told you, don't look to the header. I need one to go by this one.
The heart rate is 40 beats per minute.
Very good.
The rhythm looks regular because the R to R intervals look the same.
Very
And
good.
then the P waves are also smooth and upright. They don't look
Excellent.
abnormal.
Excellent.
The PR interval,
It's
the
like
PR
four.
interval is like, yeah, it's like 4 boxes. So it's
Very good.
16
Very good.
seconds.
Excellent. 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 Yeah.
And the QRS complex is 6 seconds. So it's less than 12 seconds. So it's normal.
Very, very, very good. So what is your interpretation?
Sinus bradycardia.
Excellent. You did your great job. Very good. This is what I need from everyone. You go like this gentleman. Done. Then we get the opposite to the previous one, which is sinus tachycardia. What is the difference? Just the heart rate is getting up more than 100. And this is like the golden slide. If you compare this one with the others, you'll find everything is okay, the same, but the heart rate is changed from 100 to 160. Then let us practice for this.
The heart rate's 120.
Very good.
The rhythm looks normal. There doesn't seem
Very
to be any
good.
differences.
Very good.
And the P wave also looks normal. There doesn't
Yeah.
seem to be any kind of
So
changes in
between
there.
you and me, we know what is the normal, but in the exam, don't say normal.
Okay.
Give the description, which means normal, but don't say normal, because in the exam they are not aware about who are you, Aaron. You know what is normal or not normal. So give the description,
Right.
and this will make much better interpretation. Very good. Keep going.
Right. So the P wave is upright and smooth,
Very
and that would be
good.
considered normal.
And what is the third item regarding the P wave? You said upright, smooth. What is the third?
Fudge.
Each P wave precede QRS.
Oh, okay, yeah.
Good,
Each P
good.
wave. Okay.
Very good. Then we have,
Yeah. The PR interval,
yes,
which looks to be about 3 boxes worth,
yes,
which is
yes,
0.12.
yeah.
So that's also that's a good rate.
Within-
and also
within-
let's see here, the QRS is also normal. It's between 0.12 and
Not between. You don't
Oh.
mention when you are going to interpret it. Don't say it like I told Zara. Don't say it should be. No. What did you have now? It is a fact. So what now? It is like how much? It is like 1.5 small box. So
Yeah.
it would be like 0.6, right?
Okay.
So
Okay.
say so it is 0.6. It is a fact. Don't say that it range between. No, it is a fact.
Okay.
Right. Very good. So what is your interpretation?
Sinus tachycardial.
Good job. Perfect. I really appreciate you. All right. Then we are going to talk about that the second step, which is rhythm, is not regular. We call this dysrhythmia. So it is not regular. Not regular. So we are going to play with the second step, and we will find that we have the following change. What this? The heart rate increase during inspiration Respiration means take inhalation and decreased during expiration. Very, very important. And I think you have this experience when you go to your general doctor, ask you, take deep breathing while he is listening to your heart. So why? He is need to expect that if your heart rate is getting fast during inhalation and slow down when getting exhalation. So this is actually, it is not a problem. It is not a disease. It doesn't need any medication. It doesn't need any assessment for the patient. So this is what we call sinus dysrhythmia. Like what? Let us have here example of sinus dysrhythmia. I need you to save this one word. MI. What is MI? Myocardial. Yes, go Zara.
Myocardial infarction.
Very good. Thank you. You are very smart. So MI means myocardial infarction. Very, very good. And also here, look, so we have the drugs, and one of them is digitalis, and you are familiar about what is digitalis. Okay. Let us go by the golden slide. It is going with the 5 steps. What is the only variation here is the second step. Second step, it is not regular. It is increased and decreased, so it will never be regular. Let us have a look for people prefer to be visual. Who can go by this one?
One.
The heart rate is 90.
Very good.
It's a regular rhythm. It's not constant, so some are like short and bigger.
Very good. Very good.
All the
There's a
people
P
who-
wave. Oh,
Go ahead.
Go. Keep going. Keep going.
there's a P wave before each QRS and it's upright.
Perfect. Smooth or not?
Not smooth. It doesn't look smooth.
No, it is smooth. So
Smooth.
far, it has a curve. It is smooth.
Okay, well, smooth and before each QRS.
Very good. Perfect. Keep going.
The length of the PR interval is between 12 seconds to 20, which is like 3 to 5 small.
No, don't give me the idea. Give me what you see already.
Oh, I see. The length of the
put the
PR
idea, put the idea in your memory and compare what you see and what you have in your memory. So this make very good diagnosis. But don't give us the okay. Go, keep going.
I see that the PR interval is 12 seconds, which is 3 squares. All the QRS complex looks alike. They're all in uniform. And
how long time?
The time I would say is 3 small squares less than 12 seconds.
Less than 12 seconds. Very good. So what is your interpretation?
Sinus dysrhythmia.
Very good. Perfect. Good job. So I need to, before we proceed to the next one, I need, because I see the majority of you are not participating, and this is hurt me. So look, guys, this distance, you see, I'll make it big sticker. this distance and this distance and this distance. Similar or not?
Not similar.
Similar. This 3, 1,
Oh.
similar. And this one, these ones, the red ones, are also similar, right?
Oh, yeah.
You agree?
Yes.
Yes.
Yeah.
So the red one, similar. The green ones are not similar. This is why we mentioned in the beginning it is irregular. This is to clarify for people, they are keep quiet, watching us, not participating. All right? All right. So,
Professor? Sorry,
yes,
I have
sir.
a question. It's a small one. So how would you differentiate between like when it's a person that's just normally breathing versus someone that has like either like a myocardial infarction or like someone who's affected by like drugs? How would you tell like the difference?
Okay. So affected by the drugs, we have the history. And
So you just
we have the answer. We mentioned that we have to ask the patient what type of medication you are receiving before we're done. This number one. Number two, when we find that the patient is in situation of bradycardia without any medication. So this question is so wonderful. We have no history of medication to slow down the heart. Listen carefully. Listen carefully. And this is very interesting, and I need everyone to pay attention. If we have the patient with bradycardia without medication, we are going to think about what? Heart block. We will talk about this by the end of our course. So your question is very good. Okay, so if I don't have any history of medication or previous heart attack, like myocardial infarction, like we had one case before, and we find that it is not present, so I have to think that this is what? Heart block. Okay, here.
Question.
And this is like what? I tell you something. I am bradycardia. I am bradycardia. I have bradycardia. My heart rate is slow. And when I went to the doctor and he noted that my heart rate is like 56 beats per minute. Okay. And he said, I need to do for you EKG. I told him why. He said, I noted that you have heart rate 56 and I need to check. I told him, what do you think? You think I have heart block? He said, how do you know? I told him, I am a doctor already. And he said, oh, I forget. Sorry. Yes, I am more about if you have, maybe you have heart block. I told him, but I have to remind you that I am already under beta blocker. I had beta blocker for many years to reduce my blood pressure. And he said immediately, that's it. Okay, so I'm not in need of EKG. Why? We interpreted the knowledge together that he thought that maybe I have heart block because I have, but he didn't remember that I had already mentioned in my history that I am receiving beta blocker, and the beta blocker reduce the heart rate. You see? So this is how medicine is going, and it is a wonderful subject, as you know, and thank you for your question. It is very interesting.
I have a question real quick,
Yes, yes.
since we're on the graphs real quick. So when we was in class on Tuesday, I had like a sinus rhythm with premature atrial complex. Does that mean like the rhythm of like my heartbeat rhythm is normal, but just an extra like contraction of the?
Yes, coming from ectopic focus from the atria. And we will get this by chapter 8 very soon. Very good.
Okay.
Yes, you're good. Okay, guys. So this is the first condition, that we don't have regular heart rate. It is serious? No. It needs medication? No. It needs any assessment? No. If I noted that, just to mention to the patient or never even mention to the patient, I will keep quiet. No problem. Okay. So what is the next we need to know about if we don't have? Let me give you this one. Don't look to the header. What you notice, guys?
It's a big long space.
We have big space without what? Without beats, without P, without QRS, without T, right? As if the heart is stopped for a while, right? So we call arrest, just the word arrest. But if we look to the rest of the beats, as you see, it is normal or sinus rhythm. So if I have this gap without any beats, I will say this is sinus arrest. And this sinus arrest need medication? No. Need emergency? No. Need any assessment? No. So why I am repeating this for you? This is question in the exam. Each exam, they ask you about any condition of the heart. Does it need assessment? Does it need help? Does it whatever? Be careful, because in the future, when we go with the ventricle, each item need assessment, because the ventricle is fatal. Problem with the ventricle should take care take our attention to the maximum. So as you see here, we call sinus arrest rhythm. Why we call sinus? Again, this is all of these are belong to the sinus rhythm. All of this belong to the sinus rhythm, but here I don't have what? All the cardiac cycle is not there. Again, what is the cardiac cycle? I told you P, Q, R, S, T. This is the cardiac cycle. I don't have this cardiac cycle for like twice or 3 times according to the space. And this is what we call change in the rhythm. And this is very easy to be achieved. And after that, we go for just information and knowledge. You have to know about what is the clinical significance of each rhythm. This is for your activity. Read it, get familiar about it. It doesn't need from me any explanation, but I am doing the job, which is explain the items which is not easy to be understood. I hope everything is okay with you, and we will reach to the end of our chapter today, which is sinus, and we reviewed everything. I hope everything is clear for everyone. And I remind you that on Monday, we will have the test. And the test will be valid only for 1 hour. Prepare yourself. The test will be valid for 1 hour. Yes.
Is our test going to be on chapter 1 through 6?
Yes. What is your problem, Al-Hajj? I know, I see your face.
It'll be on Canvas, right?
Yeah, because
Yes,
we
it
want
will be on camera. It will be on. Okay, what you say?
I just scared when you said 1 hour.
You will solve it in 5 minutes.
Oh.
Believe me.
Like we have to review until chapter 6.
1 to 6.
Okay.
And if you review all the quizzes which I sent you, you answer the exam no more than 5 minutes, believe me.
Mm.
But I'm going to give you 1 hour for any emergency or situation.
At what time? Let's see.
It will start exactly 9 a.m. When we log in, you'll find yourself that you're taking the exam.
Okay.
How many questions is it? Is it 100?
No, no.
Wait, so it'll start at 9 a.m. and then it'll end at 10? Is that what you said?
Yes, ma'am.
And then will we have class right after?
Yes.
Okay.
Dr. Israel, is it okay
Yeah.
if you could show us how to send you the quizzes through Canva?
Which one?
All of them. Because
The exam or the quizzes which I sent you?
no, the quizzes, the ones that we reviewed yesterday.
Okay, very easy. Do you know how to send the message to me?
No.
Okay, let me share with you. I will stop recording.